Yeah, Steve, the first round of National Guard deployments is now around Oregon and mostly rural parts of the state. But there are discussions happening right now about how many National Guard service members will be needed here in the metro area.
Our hospital is actually in a really dire state right now. We're overflowing with patients.
There are 3 Asante hospitals in Jackson and Josephine counties. This southern Oregon area is seeing exponential COVID-19 growth. Between the beginning of July and the beginning of August, COVID-19 hospitalizations in Jackson County increased 7-fold.
We're actually extending our ICU beds into non-conventional areas that would not normally be considered ICU units so that we can care for the patients.
Data from OHA shows there are only 4 available adult ICU beds in the 2 counties. Help inside these walls is desperately needed, and it's starting to arrive.
As of today, we have 127 troops scattered throughout the system filling various roles.
The first round of National Guard members have been deployed to central, southern, and eastern Oregon. In central Oregon, 5 hospitals received a total of about 140 service members. That's likely to increase. Most of the first development is going to 6 hospitals in southern Oregon. 250 National Guard members are now working alongside hospital staff. The jobs may seem small.
Is running food, fit testing for N95 masks, running medical equipment to RNs on the floor.
But they're crucially important.
The clinical jobs can't do their job without the non-clinical support.
As far as what National Guard service members are coming here, we do know, according to the National Guard, that it is likely those service members will be needed at more than 20 hospitals. The Guard is expected to figure out the logistics for what's needed in the metro area this week.
Well, for now in our area, I'm talking both Southwest Washington, the Portland metro area, even down to Salem. They're saying at this point it is too early to tell if they will have any sort of staffing issues as they are still collecting information. I did reach out to the governor's office as well as the Oregon Department of Education, and they say it's okay if districts delay. However, they have to meet the instructional requirement for the state, which means they could have to make up this time later on in the year, especially if they miss it. And Culver is already looking at missing 9 days.
What do we do when we have a question?
The goal is 5 days a week, in person and as normal as possible.
It's going to be a lot like we left school at the end of this last school year.
That means masks and social distancing for students and teachers. But instead of just a few days a week, it will be 5 days a week for schools all over the Portland metro area. Some rural communities like Amity and Culver are reporting concerns because of the vaccination mandate, saying they may have staffing issues for the school year. This week, the Culver School District sent this letter to parents saying we will postpone the first day of school for students until Monday, September 20th. Going on to say this provides 9 additional days to fully plan and prepare for staffing challenges caused by the new vaccine mandate. Our goal is to keep every employee. Other districts in Oregon and Southwest Washington say it's too early to know what the staffing impact will be because of this decision. The Evergreen School District in Vancouver tells me they are not overly concerned.
Both our teachers union as well as our classified union were very proactive early on in wanting vaccinations for staff.
Both states have the vaccination date of October 18th in place, meaning teachers and staff still have time.
Which really means that the last day that they can start receiving a vaccination with the Johnson & Johnson 1 dose is October 4th.
Now, another major announcement we're expecting this evening is coming from the Portland Public Schools, who is set to announce their reopening plan. We're hearing they will be obviously taking some precautions, but extra precautions like having kids be able to eat outside while weather permits to make sure that they are able to keep a distance.
Well, Steve, people have likely heard the phrase living with COVID, just like we live with the flu year after year. Is COVID-19 here to stay? I did speak with one expert tonight who said, yeah, the virus likely is here to stay, but we don't know how severely it might sicken people years down the road.
Reopening plans across the world were derailed this year when the highly contagious Delta variant started spreading across the globe. It filled many with a sense of dread that the virus was never going away. kind of like other coronaviruses that cause the common cold.
It's always, I think, been most people's expectations that SARS-CoV-2 is probably going to become a lot like some of those other ones.
Sticking around, but becoming less deadly. Unfortunately, it's too soon to predict that with certainty. PSU biology professor Dr. Ken Steadman believes the virus will stick around, but there's no way to know how severe COVID-19 might be years down the road.
So maybe it's going to be either like these common cold coronaviruses, which don't kill very many people, or it could be as bad as flu, 20, 30,000 people a year. We're really not going to know until it actually happens.
Dr. Steadman says the more people that get vaccinated, the less likely the virus will have more chances to mutate and become more dangerous.
Now, Dr. Steadman says his takeaway message here is that nearly everyone will be exposed to this virus at some point in the future, and you're better off being vaccinated when that happens.
Yeah, it is, Lincoln, especially given how vulnerable these people are. There are at least 2 facilities in Oregon with not a single staff member vaccinated. Over 100 facilities just didn't report the data to the state. Here's how that data does break down, though. Through the end of last month, 490 of 632 facilities reported the vaccination status of their employees and residents. Statewide, 67% of staff members are vaccinated, 88% of residents are. This leaves about 9,000 staff members at least to be vaccinated across Oregon. Facilities are required to report this information to the state by a recent law. However, the state has not said what kind of punishment these places that don't report will face, if any. The low vaccination numbers come as cases, outbreaks, and even deaths start to trend back up in long-term care centers. There are 72 active outbreaks in these care centers, according to OHA, accounting for over 600 cases. Fred Steele is the long-term care ombudsman.
Some of those are breakthrough cases, but more a reflection of the vulnerability of the individuals who live there. COVID continues to be a problem, even if it's not the as egregious of a problem as it was last November, December, January. It's still a significant problem.
24 people have died connected to those 72 active outbreaks. Steele says he is very concerned by these vaccination rates. They have not changed that much since the state's initial report earlier this summer that showed about 62% of staff members were vaccinated compared to about 67% right now. Of course, all of these employees will be subject to Governor Kate Brown's vaccine mandate. The big question, though, is how will the state enforce that? We're working on that answer for a future report.